She went to bed feeling perfectly fine, kissed her husband good night, pulled up her favorite blanket, and closed her eyes just as she had done every night for the past 72 years. But this time, she never woke up. The paramedic explained it was a massive heart attack with no struggle, no warning scream, no dramatic last words, just silence in the early morning hours. Having spent enough time in emergency rooms, I can share something most families don't expect. Many fatal heart attacks and strokes don't begin with chaos. They start quietly during sleep. This is because between 2:00 a.m. and 6:00 a.m., your body goes through a vulnerable period. Blood pressure shifts, oxygen levels drop, and your blood becomes slightly thicker. Cortisol levels rise. Your heart rhythm slows, then surges. For seniors over 65, especially those over 75, this combination can be dangerous, especially when certain nighttime habits are added on top. What makes this even harder to hear is that in many cases, small preventable mistakes occur before bed. Habits that seem harmless, like eating a heavy low meal, dehydration, sleeping flat with untreated breathing. Problems, taking certain medications at the wrong time, or sudden blood pressure spikes triggered by things most seniors don't associate with cardiac risk. I've reviewed charts where everything looks stable on paper, yet one or two bedtime behaviors tip the balance during the night. In this video, I will reveal 5 dangerous mistakes seniors make before or during sleep that cardiologists warn can increase the risk of heart attacks and strokes, ranking them from least to most critical. Stay with me because the number one mistake is something I still see almost every week in clinic, and many seniors wrongly believe it is completely safe. All medical references are listed below in the description so you can review the science yourself. Before we dive in, let me ask you something important. How old are you right now? Write your age and where you're watching from in the comments. I read and respond to every single one personally, almost like we're sitting together in a late-night health discussion. Now, let's begin with mistake number 5, which happens quietly before sleep, and most seniors don't realize the extra strain it places on their heart while the body is resting. Mistake number 5 is eating a heavy meal too close to bedtime. This might surprise you because many people think eating a big dinner is harmless as long as it's healthy food. But the timing of your last meal is just as important as what you eat, especially for your heart. When you eat a large meal, your body diverts a significant amount of blood flow to your digestive system to break down the food, as your stomach and intestines need extra oxygen and energy. This forces your heart to pump harder and faster to deliver all that blood to your gut. During the day, when you're upright and moving around, your body handles this well, but when you lie down to sleep right after eating, everything changes. A study published in the American Journal of Gastroenterology found that eating within 2 hours of bedtime significantly increases the risk of acid reflux, which itself can trigger dangerous heart rhythm disturbances in older adults. But that's just the beginning. When your body is working overtime to digest food while you're trying to sleep, your sympathetic nervous system stays activated. This is your fight or flight system, which is supposed to calm down at night so your heart can rest and recover. Instead, your heart rate stays elevated, your blood pressure remains high, and your body never enters the deep restorative sleep phase where critical cardiac repair happens. Researchers at Dua University in Turkey conducted a comprehensive and meticulously designed study involving over 700 patients diagnosed with high blood pressure or hypertension, a condition known to affect millions worldwide and significantly increase the risk of cardiovascular complications. Their research specifically focused on the timing of food intake in relation to bedtime and its effect on nighttime blood pressure levels. The study's findings were striking. Individuals who consumed their last meal within 2 hours before going to sleep exhibited significantly higher nighttime blood pressure readings compared to those who allowed a longer interval between eating and sleeping. This phenomenon is medically referred to as non-dipping blood pressure, where the expected physiological reduction in blood pressure during the night does not occur. Under normal circumstances, blood pressure naturally decreases by about 10 to 20% during sleep, providing the cardiovascular system with an essential period of rest and recovery. This nightly dip is crucial because it reduces the workload on the heart and blood vessels, allowing for repair processes and maintenance of vascular health. However, when this expected drop in blood pressure fails to happen, as seen in individuals eating too close to bedtime, the persistent elevated pressure on artery walls can accelerate the progression of vascular damage, including the thickening and stiffening of arteries, atherosclerosis. This sustained high pressure also increases the risk of serious cardiovascular events such as stroke, heart attack, and even sudden cardiac death during the vulnerable nighttime hours when the body should be resting. These findings underscore the importance of meal timing as a modifiable lifestyle factor in managing hypertension and protecting heart health. Fortunately, the solution to mitigate this risk is straightforward, practical, and easily implementable. Aim to finish your last meal at least 3 hours before going to bed. This gives your body ample time to digest food properly, reduces the likelihood of nighttime blood pressure spikes, and supports a healthier circadian rhythm. If you find yourself hungry later in the evening, it is advisable to choose a light, heart-friendly snack instead of a heavy meal. Suitable options include a small handful of almonds, which provide beneficial unsaturated fats and magnesium, a few slices of turkey breast, which offer lean protein and tryptophan to aid sleep, or a small cup of warm milk, rich in calcium and soothing compounds that can promote relaxation. These choices are gentle on your digestive system and unlikely to cause a significant metabolic response that could interfere with your body's natural rest processes. Your heart requires those sleeping hours to rest and recover, not to work harder than it did throughout the active daytime hours. So respecting your body's internal clock by managing meal timing can have profound benefits for cardiovascular health. However, it is important to recognize that eating late at night, while detrimental, is not the only or even the worst habit negatively impacting your heart health. The next common mistake, which affects nearly every household and involves an everyday item frequently kept on nightstands, poses its own significant risks. Before we delve into this next critical topic, which includes vital information that could potentially save your life or the life of a loved one, please make sure to like and subscribe so you won't miss the upcoming insights and advice on protecting your heart and overall well-being. Many people believe keeping their bedroom warm and cozy during colder months helps comfort and aid sleep, especially when joint pain flares. But this common assumption is not fully supported by scientific evidence. In fact, extensive research reveals that our bodies undergo a natural and essential cooling process when we fall asleep, lowering core temperature by approximately 1 to 2 degrees C, about 1.8 to 3.6 degrees F to initiate and maintain restorative sleep cycle. This drop in core temperature acts as a critical biological signal that triggers the release of melatonin, a hormone responsible for regulating sleep-wake cycles, slowing heart rate, and promoting deep, uninterrupted sleep stages that are vital for cognitive function, emotional regulation, and physical restoration. When the bedroom temperature rises above approximately 70 degrees F, 21 degrees C, this natural cooling mechanism is significantly hindered, resulting in disrupted sleep patterns, increased awakenings during the night, and an increased strain on cardiovascular function. Studies conducted by the National Institute of Health Sciences in Japan have demonstrated that elevated sleep environmental temperatures are associated with increased nighttime blood pressure and heart rate, both of which are recognized risk factors for cardiovascular events such as heart attacks and strokes. This effect is particularly pronounced in older adults who face additional challenges due to age-related declines in their body's ability to regulate temperature, diminished sweat gland function, and reduced sensitivity to heat, making them more vulnerable to heat stress and its detrimental effects on sleep quality and cardiovascular health. A landmark 2023 study involving over 11,000 senior participants highlighted that for each 1 degree C increase above the optimal sleep temperature range, sleep efficiency can decrease by as much as 10%, directly impairing overall health and well-being by reducing time spent in deep and REM sleep stages, critical for poor sleep quality. In turn, is linked to a cascade of adverse health effects, including arterial inflammation, elevated cortisol levels, the body's primary stress hormone, and the accumulation of arterial plaque, all of which compound cardiovascular risk and contribute to the development of chronic diseases such as hypertension, diabetes, and dementia. Based on this growing body of evidence, sleep experts recommend maintaining bedroom temperatures between 60 and 67 degrees F, 15.5 to 19.5 degrees C, to optimize sleep quality and support heart health. Rather than raising the thermostat to combat cold sensations, individuals are encouraged to use breathable, moisture-wicking sheets, lightweight and layered sleepwear, and a light, easily removable blanket, which together help maintain comfort while allowing the body to cool naturally. Achieving and maintaining deep sleep is essential because it enables critical heart repair processes, cellular regeneration, immune system strengthening, and overall cardiovascular recovery, all of which are compromised when the body is unable to cool properly throughout the night, leading to long-term health consequences, including increased risk of stroke, heart disease, and premature mortality. Prioritizing a cooler sleep environment, therefore, is a vital, evidence-based strategy for enhancing sleep quality, reducing cardiovascular risk, improving metabolic health, and promoting healthier aging for individuals of all ages, particularly as the global population continues to age and the prevalence of chronic diseases rises steadily worldwide, emphasizing the urgent need. Every episode triggers a surge of adrenaline and cortisol, causing blood pressure to spike and forcing your heart to beat rapidly to compensate for reduced oxygen, often leaving you restless or waking suddenly, sometimes multiple times during the night, which significantly disrupts the restorative sleep cycle your body desperately needs. Over time, this repeated stress leads to chronic inflammation, thickened arterial walls, increased blood clots, and an enlarged heart that weakens and pumps less efficiently, ultimately paving the way for serious cardiovascular complications that can dramatically reduce life expectancy and quality of life. The American Heart Association now identifies sleep apnea as a major risk factor for heart failure, atrial fibrillation, and stroke, highlighting the urgent need for awareness and proactive management across all age groups, but especially among seniors who are more vulnerable. What makes this perilous for seniors is that the classic warning sign, loud snoring, is often dismissed as normal aging, leading to many undiagnosed cases that silently worsen over years or even decades without intervention. If you snore loudly, wake with morning headaches, experience persistent daytime fatigue and exhaustion despite a full night's sleep, or if your partner observes you gasping, choking, or pausing in breathing during sleep, these are urgent red flags that require immediate medical attention and evaluation. Consult your doctor about undergoing a comprehensive sleep study promptly, as early detection and treatment can drastically improve outcomes. Meanwhile, simple lifestyle changes such as sleeping on your side can reduce apnea episodes by up to 50%, and elevating your bed's head by 4 to 6 inches helps maintain an open airway, facilitating smoother breathing during the night. Maintaining a healthy weight is also a powerful intervention. Even a modest 10% weight loss significantly lessens sleep apnea severity and improves cardiovascular health, reducing strain on the heart and artery. Remember, your brain and heart require a constant supply of oxygen at night to function optimally and repair damage, and any disruption puts your life at risk every time you close your eyes. The most critical point, however, concerns a surprisingly common and often overlooked mistake: taking blood pressure medication at the wrong time, which researchers now identify as the greatest preventable cause of nighttime heart attacks and strokes in seniors. Millions take their medication every morning with breakfast, a routine rarely questioned despite growing evidence that timing matters immensely. Most doctors prescribe once daily without specifying the optimal time to take these drugs. However, the chronotherapy trial, published in 2020, followed over 19,000 patients for over 6 years. Half took their blood pressure medication in the morning and half at bedtime. Those who took their medication at bedtime experienced a remarkable 45% lower risk of death from heart attack, stroke, or heart failure compared to those who took it in the morning. This significant difference is closely linked to the circadian rhythm of blood pressure, which naturally rises sharply upon waking, remains relatively stable throughout the day, and dips at night to allow the heart and blood vessels to rest and repair. By aligning medication timing with this natural rhythm, the heart is better protected during the vulnerable nighttime hours, reducing the risk of fatal cardiovascular events. This vital insight underscores the importance of discussing medication schedules with your healthcare provider to optimize heart health and prevent unnecessary tragedies. Taking blood pressure medication in the morning means its peak effect happens during the daytime when your blood pressure is already somewhat controlled by your body's natural activity and movement. However, by nighttime, the medication's effectiveness has usually diminished significantly, leaving your cardiovascular system unprotected during the hours when it is most vulnerable. Research from the University of Vigo in Spain has shown that an abnormal nighttime blood pressure pattern, specifically when blood pressure does not properly dip during sleep, is the strongest predictor of future heart attacks, strokes, and cardiovascular death, even more so than daytime blood pressure readings. By switching your medication intake to bedtime, the drug's peak effectiveness aligns with these critical nighttime hours, helping your blood pressure dip as it should and allowing your heart to get the rest and protection it needs. It's very important to emphasize, do not change your medication timing without consulting your doctor first, as some medications have specific requirements and your doctor needs to assess your individual circumstances. When you see your doctor next, bring up this issue and, if needed, print out the HIDEA study to have an informed discussion about whether taking your medication at night might be beneficial for you. This simple adjustment, taking the same medication you already use, but at a different time, could literally be the difference between waking up healthy tomorrow morning or not at all. Your heart depends on you to make this decision carefully. So, here's the bottom line. There are 5 seemingly harmless mistakes that quietly put your heart and brain at risk every night. Eating too late, drinking too much water before bed, sleeping in a room that's too warm, sleeping in a position that restricts your breathing, and taking your blood pressure medication at the wrong time of day. The good news is each of these issues can be corrected starting tonight without expensive devices or complicated treatments. All you need is the knowledge you now have and the willingness to make a few simple changes. Your heart has been tirelessly working for you every single second of your life. Now it's time to give it the peaceful, protected rest it deserves. If you found this information potentially life-saving, please subscribe to this channel so you never miss another video like this. Thank you so much for watching, and I'll see you in the next one.